Hypertension is a chronic condition of elevated blood pressure. Long-term undiagnosed hypertension poses serious medical risks, including heart attack, aneurysm, left ventricular hypertrophy, and kidney failure. It's well known that exercise is a great benefit to hypertensive people. However, trainers should seek medical clearance before commencing any training at all. Often, the client may not be aware that they have hypertension until you take their blood pressure during an initial screening. For this reason, it's vital that you take the blood pressure of every single client you train and immediately refer them to their GP if you discover a blood pressure score above 140/90. During strength training with hypertensive clients, the blood pressure in the working muscles is increased substantially for the duration of the set. It's therefore recommended that hypertensive clients perform unilateral exercises such as single leg press, single arm dumbbell bench press, and single arm seated row. This reduces large spikes in blood pressure during resistance training exercises. It's also recommended to reduce overhead loaded exercises, such as shoulder press and shrugs, as these exercises cause a big increase in the blood pressure in the arteries of the neck and head. Some training guidelines for clients with hypertension are to perform low-intensity cardio exercise 5 days a week, to perform moderate-intensity cardio exercise for 20 minutes 3 days a week. For resistance training, train twice a week. The weights program should comprise of about 8 exercises, include all of the major muscle groups, and complete one set of 8 to 12 repetitions for each exercise. Reduce overhead load where possible. Ensure to instruct your client to exhale during the concentric phase to avoid the Valsalva maneuver, which is a bracing technique that can greatly elevate blood pressure. Keep track of your client's blood pressure by measuring it monthly and maintain open communication with your client and their GP.